endo negligence is something that we need to be aware of. All these defendants were general dentists in these cases, and of the life-threatening infections, 7 were due to brain abscesses and 1 due to osteomyelitis. Now, of these 8 infections, 4 were fatalities and 4 resulted in irreversible brain damage. So you don't want an attorney to be knocking on your door and get the letter from the board. So of suits brought against the general dentist for broken instruments left in the canal, there were no documentation that patients were advised of the broken instruments. So if you're doing endo, instruments separate, things happen, you must document that in your chart and you must tell the patient. Then none of these cases, some of the dentists, they lack proper informed consent. So you want to make sure you look at your informed consent, make sure it's clear that these things can happen and have them to sign it. And these patients, which is the most critical, they were not referred to the specialist after the incidents. The specialists are your friends. So you want to make sure if any of these things happen as a general dentist, make sure you refer to the specialist. Now, one thing I do want to tell you is just be honest with your specialist. If you know that you perforated, you know that things happen, don't just say, hey, you know what, I'm not sure, I just saw, I'm just missing a canal. You tell them what's going on so that they can be aware of what's going on, so they can try to help you to get past any of these potential issues that can come up down the road dealing with any attorneys and things like that. Some keys to avoid endodontic negligence. Teeth that need to be endodontically treated should be evaluated for curved roots, calcified canals, and all those things. So when you do your diagnostic x-ray, make sure they're very good. Make sure they're not cone cut. If your assistant can't get a really good x-ray, get a good off-angle x-ray, you may have to jump in there and do it yourself. Always use a rubber dam. The rubber dam is the standard of care. If nothing else you hear from today, and I know a lot of general dentists, they're polled, the AAE, the American Association of Endodontists, polled general dentists, and there's probably less than half of them that use a rubber dam with a root canal. That is the standard of care. If that's not documented, if a patient takes that to the board and takes that to an attorney, it's over. It's over. So make sure you use a rubber dam. Also, infections due to endodontic procedures, they can be deadly because most endodontic infections are anaerobic in nature, and sometimes they can be very, very difficult to treat, even in a hospital setting. So I want to just reiterate, if the dentist breaks an instrument in the canal or file, the patient should be advised about it, and I would recommend refer them out to a specialist, at least have them to look at it, just to make sure that your I's are dotted and T's are crossed. So what is the standard of care? The standard of care is really something that's really handled based on location and based on attorneys involved. But the best definition I found is under duty that use the same degree of care, that every dentist is going to pretty much practice the same under similar circumstances. And it doesn't matter if you say, hey, you know what, I'm a general dentist and this is an endodontist, so therefore I can't be as good as that endodontist. No, your endo should look just as good as mine. And if you can't do that, and then you need to refer out. Standard of care, like I mentioned before, about the locality rule or community standard states that the dentist will be held to the same level of treatment that other dentists are providing in their local communities. This includes a proper referral to another dentist or physician, for that matter, when the level of care that the patient is entitled is beyond the dentist's capability. These are some Georgia dental insurance malpractice claims. In 2008, root canal poorly performed, which led to extraction of nerve damage. Cost that dentist $239,000. In 2005, a broken drill in the root canal cost $76,000. Again, this is because it was not documented, it was not told to the patient. In 2004, failed root canal leading to significant face disfigurement due to leaked solution cost $46,000. So you want to make sure that you do your due diligence, have your informed consent signed, and also make sure that you be in communication with your patients. Don't run from your patients when mistakes happen. You want to be upfront, you want to be honest with them, and if they feel like you're being upfront and honest with them, they're less likely to try to sue you and get an attorney or report you to the board. So some of the issues that I see as an expert consultant to the Georgia Board of Dentistry, the dentist did not have the proper consult to the endodontists for complex cases. They want to try to do it all because they got bills to pay and they got a lot of student loans and things like that. Trust me, it's not worth it. It's not worth it. Root canal treatment was not performed within the standard of care. We talked about that. Chart was not properly documented. Informed consent was not signed, and there was no rubber dam use. And again, make sure you use the rubber dam. Make sure when you take your x-rays, you have at least a rubber dam clamp on that x-ray, and make sure it's in your chart. Very important. So let's jump in here. Let's talk about a little bit about diagnosis. So if you don't understand diagnosis, you're going to think that you are a hammer and every patient is a nail. You're just going to go to work. You're going to start doing root canals. You're going to start doing apicals. You're going to start doing all these kind of things. But guess what? This patient may not have an endo problem. It may be something else. It may be non-odontogenic. It may be maxillary sinusitis. It may be fibromyalgia. It may be some of these other non-odontogenic things that you start doing all this work on these patients, and guess what? They're still not feeling better.